Coming up on Mayo Clinic Q&A.
The goal with this is to really reach out to our people and make sure, as our motto says, the needs of our patients and people come first. We ensure that we bring an equity lens to our practice, to the research that happens in the Mayo Clinic campus, education, as well as the community efforts.
Equity, inclusion, and diversity are important to Mayo Clinic's mission to provide excellent, culturally relevant care to patients and to create a welcoming and inclusive environment to employees.
Mayo has a very bold commitment, not just a monetary commitment, but operational commitment, $100 million from our Board of Trustees to be dedicated towards eradication of racism.
Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. In 2020, Mayo Clinic made a $100 million commitment to end racism and promote health equity at Mayo Clinic and nationwide. The goal of this investment is to address health disparities and to improve equity and inclusion at all of Mayo Clinic's campuses. With us to discuss this today is the Director of Mayo Clinic's Office of Equity, Inclusion, and Diversity, Dr. Anjali Bhagra. Welcome back to the program, Dr. Bhagra.
Thanks for having me, Dr. Gazelka. It's a pleasure.
We are so glad to welcome you back. You've been with us previously, and now you're going to give us some update on the work that's going on at Mayo Clinic.
I am delighted to share that with you.
Dr. Bhagra, would you tell us first a little bit about yourself and your roles at Mayo Clinic?
Sure. So as you just shared, Dr. Gazelka, I am privileged, honored, and humbled to serve as the Medical Director of the Office of Equity, Inclusion, and Diversity. This office brings alignment, provides strategic direction, connects, collaborates, and creates necessary training and delivery of all of our work around equity, inclusion, and diversity at the Mayo Clinic campuses, which includes not just our national sites, but also our international sites. And the goal with this is to really reach out to our people and make sure, as our motto says, the needs of our patients and people come first. We ensure that we bring an equity lens to our practice, to the research that happens in the Mayo Clinic campus, education, as well as the community efforts. And while this is a dedicated office, this work by no means is done by the office alone. We have a lot of partners. We really have an ecosystem at Mayo Clinic when it comes to equity, inclusion, and diversity, and several designated subgroups, committees, the employee resource groups spread out across all of our sites. So our goal is to bring alignment and make sure that we keep moving forward at the pace that we all wish to.
Well, that's wonderful. And before you go on, I'm going to ask you about the name of the office. So equity, diversity, inclusion, what do those terms mean and why are they important as part of the work that's going on at Mayo Clinic?
Yeah, so we have a little bit of history as far as naming the office goes. Approximately 10 years ago is when this office was formed, and it really started out as a Diversity 1.0 at the time, keeping with what the theme of our efforts were. So it started off as the Office of Diversity, morphed then into the Office of Diversity and Inclusion, and most recently renamed as the Office of Equity, Inclusion, and Diversity, or the OEID. What do these terms mean? And I like to simplify how I think about these terms. So diversity would be inviting different individuals to a party. Inclusion would be when all those different individuals are invited to dance on the dance floor. And equity and belonging is when you choose the music. In other words, diversity is respecting all of our differences. Inclusion is making sure everybody has a voice. Everybody belongs and everybody contributes without any barriers. And inclusion and belonging go hand in hand with an equity lens. And when I think about equity, there is an organized framework for equity, as well as what it means for me in day-to-day life. So the CDC, or the Center for Disease Control, defines equity or health equity as achieved when every individual, every person has the opportunity to attain full health potential and no one is disadvantaged from achieving this because of social position or other socially determined circumstances. In other words, equities and inequities, if we look at them, they seldom happen from random occurrence, but may be a result of poverty, structural racism, and discrimination at multiple levels. So that's where health equity goes. And equity to me is everyday life of having equal or equitable opportunities.
That's wonderful. I love the way you described that. And I like the analogy to the party, which I think we can all understand. That was very beautiful and simplistic. Thank you. I have a question about health equity. What sort of trends or practices do you see developing within the United States or even at Mayo Clinic specifically that are promoting health equity? Where do you see us going in the future?
Yeah, that's a great question. And I think it really allows us to think and reflect on what all happened in our environment in the last 1 year. Certainly in the midst of pandemic and dual pandemic of COVID, as well as racism and race-based inequity, we've seen a lot of change around us, change that we needed to undertake, and some bold actions or some directions that provide us a framework to do this work in an organized way. So I'm excited about several things pertinent to equity that are happening within Mayo as well as outside Mayo. I would say one of the most exciting things that I get to participate in my role is partnerships, and partnerships across sectors outside of Mayo, not just within Mayo. One of the things that we are really looking forward to on that front is our recent assignment and how we've recently become the inaugural members or designatories for racial justice in business, which is a coalition by the World Economic Forum, where there is a coalition of over 48 organizations around 15 sectors, impacting approximately 5.5 million employees.
Wow.
I personally feel that this is how we need to do this work, not in silos, but really learning from each other. In the last year, I have heavily relied on our IT colleagues and how we've quickly changed literally how we provide care and health prevention to our patients and consumers. More and more reliance on digital tools, more and more reliance on utilizing data effectively in time to pivot and change how we are providing care. So all of those are exciting opportunities, both within and outside of Mayo. I would say nationally and at all levels within our government. Federally, there is emphasis on equity efforts in terms of screening for COVID. We all saw the vaccine rollout and how quickly our administration was nimble to allot groups to overlook equitable distribution of vaccine. We saw how vaccine hesitancy was tackled by different sectors, and not just the healthcare professionals, but our social scientists, our life scientists, our political scientists. So I feel like our ecosystem, as I like to think about it, really expanded, and we went across sectors. One thing that yeah, go ahead.
No, go ahead.
One thing that excites me about the racial justice in business is just how holistic the charge of this coalition is, from recruitment of a diverse force to development of inclusive products across industries, be it healthcare.
So not just healthcare, other industries as well.
This is across industries, IT, at a global level, and in really thinking about how to tackle the social determinants of health. How do we make access to
I'm going to have you stop right there, Dr. Bhagra. There's a term, another term that we throw around so much. What are social determinants of health?
Yeah, so I like to simplify how I think about social determinants of health. So, in healthcare, we love good outcomes for our patients, but it is seldom what I'm doing in the office with for or to my patients, but the determinants of their health outside of my office that ultimately impact their outcomes. So things such as access to nutrition, good nutrition, safe and affordable housing, jobs, good healthcare, freedom from social stress, minority stress from racism. These are all examples of social determinants of health. They play a bigger role in whether or not individuals develop a disease in the first place, the severity of the disease, the outcomes of their treatments that we finally apply to them. So all of these, not just the healthcare alone, but all of these combined impact individuals. And we all know that marginalized groups are more exposed. It's these social determinants of health, such as crowded housing, no means to social distance, no private vehicle to get to your appointments, lack of transportation, affordability of health food. So the problem is very complex that we're talking about. It is multifaceted. And so the solutions are also very complex and need all these sectors coming together to provide the most meaningful outcome.
Another thing that was mentioned at a meeting that I was at this morning is social determinants for health, or how people are impacted in receiving health care, was access to major thoroughfares, highways to get to institutions, and broadband access for individuals. So being more rural can be a difficulty for some patients as well.
Absolutely. I know we all are wrapping our heads and arms around what is the possibility of remote units. What if our patients can't get to us, but what if providers get to those areas? But how do we ensure access to specialist care? And so broadband access is one of the biggest things I think we would personally need to tackle at a global level when we talk about access to healthcare. In other words, digital equity is a huge topic of discussion where we need allies, we need accomplices, we need advocacy, and we really need strong leadership to make it happen.
That's a really interesting, the digital equity, that's a really interesting topic, because I can see that that's both access to information, but also access to specialists. So we're doing a lot more virtual care here at Mayo Clinic, but if someone doesn't have access to the internet or a computer to use or a phone so that they can visit with us, then they don't have that access.
Absolutely. And we talk about digital equity being the backbone of any effective, meaningful health equity intervention moving forward. And this is exactly where that cross-sector partnership will be so critical, and why we need to approach this from a very collaborative intent.
Are there other aspects of data analytics or of technology that are helpful in promoting health equity?
So data analytics, the way we utilize data, our ability to harness it, and our ability to use it for translation into care, I feel is pivotal and key for us to address inequity. Data, in other words, is destiny. And it becomes really challenging. It's exciting, but it has pitfalls. It has nuances, because anytime we utilize data, we need to make sure, number one, that we are utilizing data that is free of bias. We are utilizing data that fully represents the population that we are considering rolling out interventions or studying. And then the teams that we use to work on these data are diverse and have inclusive approaches to not just harnessing data, but analyzing it and finally using it in forms of algorithms. So there is a very, very deliberate movement, I would say, within Mayo for sure. And there are several partners that Mayo has where we want to make sure that we are debiasing data sets, that our data is inclusive, and we are using the best data to find the most meaningful solutions equitably for populations that we care for.
And another huge part of that using data is protecting the individuals whose data is being used as well.
Thank you, Dr. Gazelka. Absolutely. Data privacy is the most important thing. And I think for our consumers, that is a top concern. What are we doing to protect your data? Again, this is not something Mayo can do alone. We need partners, and we want to be able to do an excellent job at this. And this is a strong area of our focus as we mine big data, as we collect this data. We fully respect the trust that our consumers have put into us, and we take this very seriously.
Whew, I'm getting the image that this is a huge area of work, both outside of Mayo, which we've been discussing, and inside. Can we talk for a few minutes specifically about some of the activities that have been going on inside Mayo Clinic? And I'm thinking specifically about asking you about the Everybody In campaign.
Absolutely. So Mayo has a very bold commitment, not just a monetary commitment, but operational commitment, $100 million from our board of trustees to be dedicated towards eradication of racism. And for us to be able to build life around this commitment, we have several partners with OEID, our public affairs team, along with many other teams for staff engagement. Most of the engagement efforts within our staff are related to increasing awareness, increasing ability to contribute meaningfully towards these efforts, and sharing those initiatives, not just within Mayo, but spreading this to our communities. And with these initiatives, we hope that our patients and consumers that either walk directly within the walls of Mayo Clinic or we reach out digitally, we want to make sure that we are providing an equitable access to highest quality care to our patients. And as an example, one of the initiatives is a recent launch of an app called the Everyday Inclusion app. This is available to our colleagues at the bedside during meetings, and it really walks you through what would I do or what should I do if you're caught in a situation where you're not sure what's the right thing to do with a patient from a background that you don't fully culturally understand the barriers about certain aspects of care. Not just within patients, it also enables for improved peer-to-peer interactions.
So the app is describing various ethnicities or groups. Tell us a little bit more about how the app actually works or what's in it.
So the app actually has a list of trainings at the bedside, cultural competency trainings. So there's education built into the app. It makes you aware of events happening close to your geographic area that you could participate in. It also walks you through specific examples of how to have a crucial conversation, how to have a safe conversation. What do you do for inclusive meetings? How do you care for a patient from a certain background of a certain faith? What are some do's and don'ts in a certain cultural background? So it really allows for a lot of not just education, but in the moment action that would be culturally sensitive. And I hear this from my colleagues all the time. They all want to do the right thing, but many a times they're just not sure of what is the right thing to do, what's the right thing to say. So it walks you through what are the right things to say in certain situations. I personally use that app several times a day, not just for how to interact with my patients, but believe it or not, sometimes how do I talk to my kids? How do you talk to teenagers? So I just find it so powerful. You know, I call it my inclusion buddy. And it gives you reminders every morning, like now is the time for you to go over some module. You can bookmark. If there are things that I've needed to see often, I can bookmark that. So it's a very user-friendly way of becoming an inclusionist.
I think I was just having trouble visualizing the use of the term at the bedside. So I'm picturing someone in the hospital standing at a patient's bedside going through things on an app. And I also think we have computers where we have our Epic record, and sometimes we have an interpreter in the room on an iPad. And so is this just we're holding another piece of technology in front of the patient's face, or is it not really at the bedside?
So it can be at the bedside if you need to. The way I personally use it is before going in the room, I'll look up what I need to for the patient. But I am surprised by how savvy my patients are. Sometimes, you know, I've had I've had my patients and myself learn together in the room, and they're just fascinated, and they've told me how accurate it is. And they've actually wanted to download the app because they feel like it's a great way to learn. So you can use it in a variety of different ways, just however you see best fit. I would say a lot of our consumers love if the provider is making the effort to learn about them, because in the short period of time that we have with our patients, you're absolutely right. It's hard sometimes to do justice to everything. You want to listen to them in a compassionate way, but also you don't want to be distracted by another piece of technology in the room.
And how wonderful to have that information right at one's fingertips instead of having to Google and not know quite where you're compiling things from. That's terrific.
Right. Absolutely. And I do think there's quality control as well. It is something that we deliberately picked. We are confident of the content that this app offers, so we can be reassured that we're going to get the best information that we're looking for, because there are a lot of sources of information, but not always the best sources.
Tell us how the